Hi, my name is Sarah, and I'm here today with iHealthBrokers to give you an update on costs for Medicare in 2021. Today we're going to be talking specifically about Medicare Part A and Part B. This is Part 2 of our Medicare Costs of 2021 series. Make sure to check out Part 1 for Medicare Costs for Part C and Part D. All right, stay tuned. Hi, and welcome to our channel. We release videos designed to educate and inform people about Medicare and health insurance in general. So please make sure to like this video and subscribe as well if you're new to our channel. We release videos on a weekly basis that are designed to demystify health insurance. Too many people are confused and very often intimidated about health insurance, which leads to people enrolling in the wrong types of plans or no health insurance at all. Either way, you could end up with exorbitant medical costs or allow illnesses to progress way too long, which will lead you to even bigger medical costs. So like I said, we try to make the whole process a little less confusing and a lot easier. We're licensed health insurance brokers, so please feel free to just leave a comment below and we will absolutely do our best to help. And you can also reach us here at iHealthBrokers at 888-410-0344. There is absolutely no charge for our services whatsoever. If all we can do is answer a question, that is enough for us. So today we're going to be talking about the costs for Medicare in 2021, specifically Medicare Part A and Medicare Part B. There are a couple of changes and I want to go over those with you today. Medicare Part A is your hospital insurance. Medicare Part B is your outpatient insurance. And together they cover most of your healthcare needs. Generally speaking, Medicare will cover about 80% of covered services, leaving you with about 20%. But there are always out-of-pocket costs to be aware of, and this goes with all different types of health insurance. You need to be aware of costs such as premiums, deductibles, copays or coinsurance, and out-of-pocket maximums. Now, these do tend to increase every year to accommodate for inflation and rising healthcare costs. Your monthly premium is what you have to pay on a monthly basis to keep your insurance active. Now, most people actually don't have a monthly premium for Medicare Part A. If you've qualified based on your employment history or your spouse's employment history, then you'll have a $0 monthly premium for Medicare Part A. However, if you haven't quite met those 40 quarters, there is a monthly premium to be aware of, and of course, there are some changes in 2021. If you don't meet the criteria for the $0 premium for Medicare Part A, in 2021, your premium will jump from $458 to $471 if you've worked less than 30 quarters. If you've worked between 30 and 39 quarters, the new monthly premium is $259. It was previously $252. So that's actually not a huge increase, and it doesn't affect most people. Also remember that if you're continuing to work, once you hit that 40 quarters, your monthly premium will disappear for Medicare Part A. Now, Medicare Part B always has a monthly premium, and that's determined by your income. They're going to look at your taxes from the 2 years prior to determine your income bracket, and that will determine your monthly premium for Medicare Part B. So let's take a look at the breakdown of what the changes will be from 2020 to 2021. So there are 6 brackets. Now the brackets themselves have actually changed ever so slightly from 2020 to 2021, so be aware of that as well. If you're in the first bracket, in 2020, your monthly premium for Medicare Part B was $144.60. In 2021, that will be $148.50. If you're in the second bracket, your monthly premium in 2020 was $202.40. In 2021, it will be $207.90. Now in the third bracket, in 2020 you were looking at $289.20. And now in 2021, it will be $297 even. In the fourth bracket, in 2020, your monthly premium was $376. And in 2021, it will be $386.10. In the fifth bracket, in 2020, your monthly premium was $462.70. And now in 2021, it will be $475.20. And finally, in the last bracket, your monthly premium used to be $491.60. And in 2021, that's going to go up to $504.90. One thing I do want to mention about those monthly premiums, as I said before, they're looking at your taxes from 2 years prior. But if your income has drastically decreased in those 2 years, perhaps you've retired and you're no longer receiving the same income, well, you can file an appeal to have access to a lower monthly premium, and you do that with Form SSA-44. I'm going to put a link to that exact form in the description below. Now let's talk about deductibles and coinsurance. The deductible is the amount that you have to meet out of pocket before your insurance kicks in. With Medicare, once it kicks in, then you have coinsurance to be aware of. So that is a percentage of the covered services price that you'll pay. With Medicare, it's going to be about 20%. So first, let's talk about Medicare Part A. For Medicare Part A, the deductible in 2021 is now going to be $1,484. In 2020, it was $1,408. So that's not a tremendous increase, certainly not at all, but I do want to talk a little bit about how exactly that deductible works with Medicare Part A, because it's probably a little bit different than what you're accustomed to. Medicare Part A's deductible is not applied on a yearly basis, but it's applied specifically to a certain benefit period. Let me explain. So as a reminder, Medicare Part A is your hospital insurance. So let's say that you have to have a procedure done at a hospital and you're going to be there for 3 days. Well, during that 3-day benefit period, you must first meet that deductible before your insurance kicks in. Now let's say it's a couple months later and you have to have another procedure done. Totally unrelated. And this time you're going to be at the hospital for 10 days. Well, you're going to again have to meet that deductible during that benefit period before your insurance kicks in. There's also some variation with the coinsurance with Medicare Part A. For the first 0 to 60 days, your coinsurance will be $0, and after that, you're going to be charged. Then there's Medicare Part B. Medicare Part B is much easier to understand. It is a one-time deductible. You meet it once and then your insurance kicks in. So in 2020, the deductible for Medicare Part B was $198, and now in 2021, it's going to be $203. It is a pretty negligible difference. The only thing that I do want to mention is that with Medicare Part B, there can be what's known as Medicare Part B excess charges. So with Medicare Part B, once you've met your deductible, your insurance kicks in, and now you're going to be responsible for about 20% of the costs. Possibly not that big of a deal. However, some doctors and hospitals choose to charge more than what Medicare will cover. They can charge up to 15% more, and you're responsible for that unless you have a Medicare Advantage plan or a Medicare Supplement plan that will cover those Medicare Part B excess charges. Finally, there are out-of-pocket maximums. The out-of-pocket maximum is just that. It's the max that you would ever have to pay out of pocket. Now, unfortunately, Medicare Part A and Medicare Part B do not have out-of-pocket maximums. That's why a lot of people look towards Medicare Part C, which is Medicare Advantage, or a Medicare Supplement plan to restrict what their out-of-pocket costs might be. You can pay a little bit more on a monthly basis to give you peace of mind. So, if you're looking to enroll in Medicare Part C or Medicare Part D, then you're going to do so either during your individual open enrollment period, a special enrollment period, or the annual enrollment period, and that's every year from October 15th to December 7th. Now, because Medicare Part C and Medicare Part D are offered by private carriers, you can contact the carrier directly, or you can check out all of the available plans on Medicare.gov, that's Medicare.gov, or contact the website directly if technology is just not your thing at 1-800-MEDICARE, or you can call us at iHealthBrokers at 888-410-0344. And then, of course, we'll get back to our topic at hand today, which was Medicare Part A and Medicare Part B. You can enroll in those during your individual open enrollment period, a special enrollment period if you qualify, or during the open enrollment period, And that's every year from January 1st to March 31st. Remember that you really do want to enroll during your individual open enrollment period or a special enrollment period, because if you miss either of those, you may be subject to a late penalty, which nobody wants. You can make sure to check out our YouTube video all about the specific enrollment periods to make sure you don't miss yours. And then of course there's Medicare supplement plans, and you can enroll in those year-round. Now, speaking of Medicare supplement plans, make sure to stay tuned because we will soon be releasing part 3 of our Medicare 2021 Costs series about Medicare supplement plans. If you have any questions, you can reach us in the comments below, leave us a question, and we will absolutely do our best to answer. Or as I said, you can reach us here at iHealthBrokers at 888-410-0344. And please make sure to subscribe and check out our other YouTube videos. We've got a Medicare playlist that is sure to answer most of your questions. Thank you so much and have a great day. Bye-bye.